Infertility is not an inconvenience. It's a disease of the reproductive system that impairs the body's ability to perform the basic function of reproduction. Infertility affects about 6.1 million women and their partners in the United States, about 15% of American couples. Oftentimes, couples spend years struggling with fear, frustration, and hopelessness. However, today, advances in the diagnosis and treatment of infertility offer both help and hope for the majority of couples. To learn more about the treatment of infertility through the use of assisted reproductive technologies, we turned to Drs. William Couttet, Raymond Key, and Ringland Murray of Fertility Associates of Memphis and Memphis Fertility Laboratory, and spoke with reproductive endocrinologist Dr. William Couttet, managing partner.
Here at Fertility Associates of Memphis, our physicians have a combined clinical experience of almost 40 years. We understand your hope and desire to create a family. We offer state-of-the-art medical and surgical treatments and boast a nationally ranked IVF program with outstanding delivery rates.
Using state-of-the-art advanced medical care, Fertility Associates of Memphis offer a comprehensive and highly successful program ranked among the top 15% in the nation for the treatment of infertile couples. Their physicians are certified high-complexity lab directors and are certified by the American Board of Obstetrics and Gynecology after completing full fellowships in reproductive endocrinology and infertility, the only Mid-South physicians to achieve this qualification. When couples faced with infertility are still unable to become pregnant after first-line therapy such as ovulation induction, intrauterine insemination, or reproductive surgery, the logical next step to explore is assisted reproductive technologies. One of the most widely recognized technologies is IVF, or in vitro fertilization. This method involves obtaining eggs from the prospective mother and mixing them with prepared sperm to bring about fertilization outside the body, or in vitro. Developing embryos are then placed back into the prospective mother a few days later.
While IVF is the most recognized assisted reproductive technology, there are many others. Both intracytoplasmic sperm injection, known as ICSI, and donor egg IVF have revolutionized the treatment of sperm and egg defects. Other techniques include assisted hatching, thawed embryo transfer, blastocyst culture, and pre-implantation genetic diagnosis.
Pre-implantation genetic diagnosis is a reproductive technology used with an in vitro fertilization cycle. PGD has the potential to allow couples at risk for severe genetic disease to have healthy children.
Well, the most common type of PGD is for couples with specific genetic abnormalities that are already known, such as sickle cell disease. The couple will go through in vitro fertilization, the embryo will be tested, and then only those embryos which are thought to be disease-free are transferred back into the uterus, resulting in a healthy pregnancy.
After struggling so many years with infertility, my husband and I came to visit Dr. Couttet, and we knew after our first visit that if we were ever lucky enough to get pregnant, it would be under his care. And the reason why, he strives for perfection. He cares and he listens. And because of this, we have our two little miracles. So we thank you to the Fertility Associates of Memphis.
Fertility Associates of Memphis and Memphis Fertility Laboratory are committed to providing full-service infertility and reproductive endocrine health care with a focus on patient-centered, compassionate care. Their patients are handled as individuals, and treatment plans are developed to provide results as quickly and safely as possible.